Good evening. I'm Gary Christenson, Mayor of Malden, and I want to welcome you to tonight's show where we're going to be giving the community the latest update that we have regarding COVID-19. So one thing that we've learned throughout this ordeal is that one of the most important things is to communicate, and communicate. So we've been trying to do that through social media, through the press, and just this week we're doing a series of robocalls which are also up on our website and translated into multiple languages. So tonight we're joined by our police chief, who you all know, Kevin Molis, as well as our Human Services and Community Outreach Director, Karen Cologne Hayes. So before we begin, I just really want to say thank you to you both, as well as the rest of our directors and staff within Malden City Government. One thing that I have not heard back from our city is the inability to reach any of our departments, and that's a testament to you and everybody else that works here in Malden. We also want to take an opportunity to thank Malden Access Television for quickly helping us to organize this forum, which is another attempt to try to help get the word out as to what's happening in our city during these very trying times. So as we typically do, I just want to give our police chief an opportunity to say a few words, as well as Ms. Hayes, and then most importantly, we want to get to your questions and phone calls as soon as possible. So without further ado, Police Chief Kevin Molis.
Thank you, Your Honor. Good evening, everyone. Practicing safe social distancing, I'm the only one here, but I'm really here on behalf of all of your police officers, firefighters, and EMTs. We can't all fit in this room safely, but I am here to tell you that emergency response to calls and fundamental public safety needs are being met each and every day as we speak by your police officers, your firefighters, and your EMTs. I have witnessed it. I have personally responded to calls and seen it. The work continues. The support from the city government continues. The communication continues. I think many of you know my style is to be out in the public and to engage you personally as often as I can. Social distancing kind of puts a limit on that, so I want to thank the mayor for providing me this opportunity tonight to do my best to try to reassure you, and again, to let you know that your police department, your fire department, and your EMS workers, fully supported by this city, continue to work with you, for you, and together with you, and we will prevail in the end.
All right, great. Thank you.
And, good afternoon, and thank you for this opportunity to get the word out to the public. So I'm the community outreach director as well as the human services director, but the community part right now is really coming in handy. What's happening now, this rising up of the community to offer help and volunteer has been truly tremendous, and all the connections that I've made over the past few years out in the community are really coming in handy right now. So we're trying to funnel everything up into one place and organize a way where we can get our volunteers that have been coming out ever since this has happened. So I think right now maybe we have a list, and we'll get into details later, but we're, just the volunteer effort has been huge, so I'm glad to be a part of it.
And again, these are challenging times, but one challenge we have not had is receiving support from the community, from Pizza Pizza, Encore Boston Harbor, residents themselves have all really come together to try to help weather the storm here. So I think we both, we all want to say thank you to the residents for their patience and understanding, again, through something that we've never seen and we hope we never see again. So just a couple of updates, and then we want to get to your questions. As of yesterday, the city of Malden has 9 confirmed cases, and we believe these cases are most likely from interpersonal contact. So, it used to be from conferences and parties and get-togethers, but we believe these 9 confirmed cases are from interpersonal contact. So that's why both Ms. Hayes and Chief Molis have been saying social distancing. I know it's a word you're probably getting tired of, but it is essential from what we're hearing from all the public health experts, that we need to do right now. The health department has been in touch with those affected residents, and they are cooperating and are following all quarantine protocols and precautionary measures. We believe that these numbers are only going to increase as more testing occurs. The U.S. Surgeon General said this will be a bad week, and most likely there will be more to follow. We also have 57 presumed cases. So outside of the 9 confirmed, 57 presumed cases, with an additional 21 people who are in isolation right now due to contact with these individuals. So the other thing that we wanted to let you know that we just announced this afternoon, the closing of city parks and our community gardens. Now this was a very difficult decision. Last week I think we all felt, along with our health director Chris Webb and our rec director Joe Levine, that we could get by with limiting activities but not closing them off for those who wanted to, have some type of passive activity during this crisis. But I think, as many of you saw over the weekend, that did not happen at some of our parks around the city, which has, caused us to close them effective today. So that's in effect. Our police chief, the offices, other officials, Joe Levine, will be traveling around to make sure that that protocol is being followed. We are not going to extend this new measure to the bike path because we don't see that as a place where people are congregating, and they are keeping a pretty good distance as asked for by our public health officials. So as the situation remains fluid, we are going to continually check in with our health director and rec director to see if at some point we can change course, because this was a very difficult decision, but based on everything we're hearing, it was important to do. Another thing that you should be aware of today, Governor Baker and Lieutenant Governor Polito, who I was on a conference call with earlier this afternoon, have filed legislation that would affect tax bills and property tax exemptions. As you all know, bills are coming due May 1st, and so their bill would extend that to June 1st. It would be an option that I'm sure our community would look to adopt if passed by the House and Senate and signed by the governor. And then the other thing is the same would happen for property tax exemptions. So I know there's like a dozen or so of those exemptions that are due April 1st. If the legislature and the governor were able to come together on this bill, it would extend that. It would allow municipalities to extend that to June 1st. Some other news that just came out this afternoon, the Baker-Polito administration also directed the Department of Public Utilities to prohibit the shutoff of gas, electric, and water service to residents, industrial, commercial, and small business customers for failure to pay a bill or a portion of the bill until the state of emergency is lifted. Now, I don't believe that is legislation. They directed the DPU to put that into effect, which I think it already was for residents, but they're extending that now to industrial, commercial, and small business customers. The sending of communications that threaten the shutoff of gas, electric, or water are also going to be prohibited during this time. So with that being said, I know a lot of the questions that we've been getting from our city in the past 24, 48 hours, what exactly does Governor Baker's stay-at-home advisory mean for our community? So, Chief, I know you've spent some time looking over that order. What do you think it technically means?
Sure. Again, a lot of it's based upon common sense. It's an official position or an initiative by the governor, which has now manifested itself, but I think it's clearly trying to reinforce social distancing in as many areas as possible. People understand the reason why that is. The idea is to limit the spread, to flatten the curve, or all these terms that have been used, by limiting the amount of contact that people will have with one another. So most importantly, originally the governor had issued an order that limited the size of gatherings to be no more than 25 people. Well, that number has now been reduced to no more than 10. So again, this is a tightening of the restriction. A lot of it, though, is reinforcing something that I think most people already know. I think when rules and regulations and laws are created, I think people are more inclined to accept them when they believe there is wisdom behind it there are facts that support it, and there is evidence that really reinforces why it's being done. Something that you said, the issue of the parks. It's something that was well thought out. It was something that we did not do right away. We looked at what was unfolding. This is an evolving thing, as you and I speak throughout the day. In the morning, it's different than the afternoon.
Right.
And I think all of these measures are designed to create that social distancing for a period of time when we can see the results and see if it's working. So how that plays itself out, the number of no crowd greater than 25 gathering in a public setting or even a private setting has now been reduced to 10. And that's what it means. You know, no more than 10 people could gather in any setting, whether it be a parking lot, you know, public land, or things of that nature. And even if it is less than that number, the encouragement or the advice or the urging is to engage in the safe social distancing.
Right.
So that's what all of these things are for. Again, in these times, we look at the public more as our partner as we do. The police are certainly not looking to go around in the public and become the social distance police. We believe that people understand why this is being done. And if we were to see, you know, violations of this, I think in the early phase it would probably involve some type of verbal interaction and a warning, maintaining social distance, but reinforcing the reason why.
All right. And Ms. Hayes, can we just, from you before we take questions, I know you really are, you know, have been impressed with a couple of people that have stepped forward and established this Facebook page that kind of collates all of our volunteers.
Yeah,
Talk about that.
Malden Neighbors helping Malden Neighbors. But so where I see my role coming in is actually working with the community who has to follow the rules and regulations. So you're staying inside now. Now what's going to come in is, what does that mean? It means social isolation. You know, physical distancing is what we like to say, is because people are going to be socially isolated. So like now we're trying to figure out how do we work with that. Now you're inside. Now you can't go out to the parks. You're stuck in there with your family. You know, seniors can't go out. They can't come to the senior center. Right. So what can we do for them? And so that's where this group came. And you know, everybody was kind of thinking the same thing. And then all of a sudden, I get a phone call and from this organization that really kind of took it to the next step. They started organizing, and AJ, and there's a bunch of them. I don't want to leave anybody out, but it's Malden Neighbors helping Malden Neighbors. And so what it is they listed things that they thought could help while you're home. You might need somebody to pick up your prescriptions. You might need someone to help, you know, buy groceries for you, to actually walk your dog. Things that you wouldn't really think about, visiting, talking, just calling them up and having a phone call with someone who's feeling scared and nervous and they're by themselves. So this group and a bunch of us now have we're going to kind of take it from there and help the people while they're home to get the things that they need.
And I want to say, I know you've been in touch with a lot of the organizations. Thank you for that. I know you've been talking to Steve Finn, the executive director of the Malden Housing Authority, and our seniors are hanging in there. And speaking of seniors, we want to make sure the seniors at Malden High School and across our city, we're thinking of them. I know this is a tough time with all of their last activities coming up before they graduate, and you know, we're thinking of them, and we're going to do everything we can to make sure that we get back to our lives as soon as we can. Now, speaking of which, one of the questions I had today to the Lieutenant Governor was, you know, how long does she foresee this happening? Because we've heard, you know, mid-April to the entire month of April and beyond perhaps, and then last night the federal government hinted at maybe us coming back a little sooner. And her response was, at a minimum, the date we should look to receive an update as to where we're going is April 7th, which is the expiration of the stay-at-home advisory. So as we approach closer to that date, the state will then make a determination as to the next steps. So again, as always, stay in touch with us, cityofmalden.org or 781-397-7000. And we also just want to reiterate our gratitude to all of those who have called us to offer their assistance and support. And, you know, our business community, what's there to say? Pizza, Paul Murphy Insurance, Yankee Pest Control, Creative Audio, and the list goes on. Super Stop and Shop, I heard, has been doing some great things for our seniors. And so again, on behalf of all of us, we want to say thank you to you all. So let's do what we're here for, and that is to take some questions either through Facebook or via the phone.
So, Mr. Mayor, I will be fielding the questions both and relaying them to the panel. Our first question is a phone call from Vicki. Before we get to that, I just want to remind folks at home to dial in. It's the number is 781-388-9394. And I am actively monitoring Facebook, so if you'd like to type your message in, I'll read that and then relay it to the panel. So with that, we have Vicki on the line right now calling studio.
Okay. Hi, Vicki.
Hi. Thank you for taking my call, Mayor
Pleasure.
Christenson. I do have a question. I am a nurse, and I have several loved ones that are first responders. And I know, being a nurse, that we're having a lot of trouble at the hospital getting protective equipment for our first responders, both in the hospital and on the street. So I didn't know, I know the President has not enacted the Defense Production Act yet, or he hasn't sort of moved forward with it. And I didn't know if you could address that and how you see our community, how you see, the PPEs, are they coming? Do we have some? And just what the timeline you think will be for protecting the first responders.
All right, I'm going to ask Ms. Hayes to comment, because I know she's been in touch with some people who are trying to organize the supplies that you need. But before I do, I think, again, on behalf of all of us, we want to say thank you for what you're doing. Believe me, I know sometimes you may think it goes unnoticed, but all of us up here on stage and throughout the community really want to say thank you. So,
thank you.
So, Ms. Hayes, what's the lay? I know you've had some groups step forward about.
So it's not really what I've been hearing more are the masks, and I know that a lot of the masks that are used, they're not the official. I mean, obviously you're not going to operate with them, but there are masks that are coming in now, and I know of 2 organizations that have really stepped up, and one is My Do, actually, and she's a community organizer in Malden, and she's been raising a lot of money and getting in some masks that she already put on order. I mean, I think she raised something in the line of like $10,000. And so she's trying to get some equipment in. So I know that she's been working hard on that. We also have Mei Hung from the Chinese Culture Connection, who I'm going to start picking up masks that she has also gotten some from, and then we're going to pick them up at the senior center and then get them to the hospitals. I know that CHA they put a call out for equipment, so we're going to work with them. And Melrose Wakefield also has put out some, a call for masks specifically. That's what we heard. So we are working, believe it or not, with like a lot of donations.
So if Vicki wanted to get in touch with you offline, what's the best way to reach you?
So you could email me. That's the best way. I've still been out and about. So it's khayes, KHAYES, @cityofmalden.org. And I know that honestly, too, there's seniors out there that are actually sewing masks right now, because that's the #1 thing that we've heard right now. So we're really working on that, and so is the group.
So, Vicki, if you can, reach out to Karen Cologne Hayes at khayes@cityofmalden.org, and we'll see if we can steer some of those supplies that are coming our way to you. In the meantime, make sure that you're on the phone with our federal officials and our state officials to find out exactly where they are with doing what they can at their level. They have a greater capacity, of course. So, for our state delegation, it's State Senator Jason Lewis, and then our representatives are Steve Altrino, Paul Donato, and Kate Lipper Garabedian. And then, of course, at the federal level, our Congresswoman is Catherine Clark, and our U.S. Senators are Ed Markey and Elizabeth Warren. So it would behoove you to reach out to them just to find out what's going on at their level.
Okay, our next question is coming in through Facebook. It's been asked quite a lot, so I figure I will summarize, and that is the blue bag situation. What is being done long-term, and what is the availability of blue bags now for those who can't get out?
Yeah, we've been meeting on that as well, and we understand the concern, and we've been in touch with the City Council, who had contacted us to see what we're thinking during this stay-at-home advisory. I think right now we're going to go as follows, which is our vendor and our stores said there's been no disruption to the delivery and the stocking of the bags. However, We know there are people that, so what we are doing as a city is, making arrangements to bring the bags to our customers. So that's what we're going to do now for the time being. Now that could change, but the one thing that we're trying to weigh is if we were to do anything, what it would mean to the sustainability moving forward. So we will keep you posted. We are working on it, and but right now we feel confident that, again, the delivery and the stocking of the bags hasn't been an issue during this stay-at-home advisory order.
Okay, our next question is a phone call, and that's from Jack. So we'll hear Jack's question.
You're on, Jack.
All right, we probably lost him. So we may have temporarily lost Jack, so what we'll do is go to a Facebook question in the meantime. Actually, first there was a comment here from Kev Graham, and he suggests that maybe the chief or one of our other public officials could do, he says, sometimes we forget about the small things. He said maybe someone could do a hand washing demonstration, and we could put it out as a YouTube video or some kind of instructional. So that's a great suggestion, Kevin. We did relay that to the panel. Next question is back to schools, and wondering if there are any intentions of completing a graduation, even if it's in late summer or if it's severely affected. Will there still be a walk for the seniors this year?
Yeah, I don't want to speak for our superintendent or the school committee, but if I know them well, we will find a way to commemorate, all their hard work and dedication during their years in the Malden Public Schools. We don't, again, we don't have an answer yet, but it is something that we are actively talking about. Principal Mr. Angelo, I see, has been posting up and letting the students know that we are thinking of them as well. And so once we have a plan, we'll make sure to let our seniors know as soon as possible.
Okay, our next question is a phone call question, so we're going to bring that in now. And name again on the phone. Phone call is from? Hello? This is from Joan.
Okay.
So Joan, go ahead and ask your question.
Hello?
Hi, Joan.
Hi, Joan.
Yes, I'm a concerned senior citizen, and I would like the mayor to say more about the 9 that have been affected, the ones that are isolated, presumed, what the protocol is, and exactly a little bit more about how we can get this virus.
Okay. Again, our health department has been in touch with all of the 9 residents that have been confirmed to have COVID-19. So there isn't someone out there that is running wild. I mean, we know who they are, and they have been cooperating with us from the beginning when they knew. So all the quarantine protocols are being followed, and the precautionary measures going forward are in effect. And as I mentioned at the outset, we believe these numbers are going to increase as testing increases. So our health department is on top of it. They're confident that there isn't anybody at this point that's been missed. We'll get another update as to where we are on, I think it's Wednesday. Tomorrow we should have another update from the state. One thing that did come up, though, someone asked us if we could pinpoint, where their location is, and we cannot do that. The only thing that's happened during this crisis is there has been an exception, a small exception made to the HIPAA law that allows our public safety officials to be in contact with our health department because, that is necessary under the crisis that we're undergoing. Our first responders are going to be at the scene of some of these cases. And so, I think the officials from above thought it was important that they're sharing information. I don't know if you want to add to that, Chief.
Sure.
And do you want to add to that, too? Okay.
As you said, Your Honor, that one of the good aspects of this is a genuinely agreed upon collaborative, cooperative effort. The compassion and the sincerity of the delivery of service to those affected by the illness and those who are called upon to respond to it and provide care. There's a I think, a very good blending of the needs of those involved. So from the public safety perspective, it is wise and prudent for us to be able to know the locations if and when we are called to respond there, so that those going there can take the heightened precautions that we all need to do. But as you said, there is also a need under the law to protect the privacy, because, to be clear, the location itself does not present a risk to the public if the public engages in safe social distancing and all the measures that are being asked of them. So, I mean, knowing the location really wouldn't provide you with an added layer of protection. You have no reason to be going to these locations. They are not public locations. They are not businesses or anything like that. We know the locations where they are. As you said, Your Honor, the people that are affected are being cooperative. They're receiving treatment, and all of the safe protocols that will facilitate their return to health are in place, and also the things that can protect us. If I could just, for 1 second, to explain to the caller and maybe to the public that one of the changes in first response protocols for us has been the recognition that first responders, police, fire, and EMS are, by the nature of their job, required to go to places where others don't have to go. But we still have to do everything we can to offer protection. So what we have done is, when the police now dispatch receives incoming calls from the public, regardless of the nature of the call, we ask the person, is there anyone at that address experiencing flu-like symptoms, or have they been in contact with somebody who has been confirmed? Now, the reason for that is if the police need to respond to that home for a call, say it could be even related to a required police response for an alarm or something, they at least know that that information has been voluntarily supplied. Because I think what you said is very important. We're balancing the rights of people's privacy with the common good of the public. So we're trying to do that. And so I would say right now, the way things are being done, the way the data is being updated every day is giving us a good handle on what we're doing as a community, as a state, as a country, and as a world. And I believe it's a great example of a good response.
Okay, do you want to add to that?
Yeah, just a simple that I know it's scary. You're home, and I'm going to assume that maybe you're watching TV. There's so much stuff out there, and it feels really, if you're alone, it's sometimes overwhelming. So what I've been telling seniors who have called really is, if you're not leaving the house, you don't have too much to worry about. And if people are coming into your house, you can offer another level of assurances, that have them take off the first layer of clothing when they come in, wash their hands, because you can have it contact by that. Make sure you're staying away from them, and don't even have to let them in if you don't have to let them in. And then, I told the same thing to my father, so I get it. Stay in the house. I know it's hard, but that's your safest bet, especially as a senior right now.
Okay, so Joan, HIPAA remains the law except for this, exception during this crisis.
Okay, our next question is another phone call, and that is Lee. So Lee, go ahead and ask your question.
Hi, Lee.
Yes,
Hi. Are you there, Lee?
I'm here.
Hi.
Hey, Lee, go ahead.
Okay, for those of us who are not seniors, when I go to the supermarket, it is very crowded. Can the city work with the local markets in the area for a better solution?
Yes.
Especially when we're in the checkout line, no one is adhering to 6 feet away. They're all on top of each other.
Yes, we will do that. Our police chief was just talking to me this afternoon about that. So I think from here, he's going to be heading on over to Super Stop and Shop and the other 2 markets to come up with a system that works for us all. I mean, some that I've seen in other places is you actually wait in a line prior to getting to the cashier. So we'll look at doing that. That's a great suggestion.
I've been in those stores too, and we're all packed in like sardines. And also in Trader Joe's, they have you wait outside. And again, outside we're packed like sardines.
Yep. No,
I know it's a
understood.
catch-22.
Yeah, for sure. But you're right. So we have to we have to get on that, and we will if I know our police chief, like I think I do. So let us know if you don't see any changes in the next couple of days.
Mayor, thank you very much. I appreciate it.
You hang in there.
Bye-bye.
Thank you.
So, Chief, we got to do that, all right?
Yes.
Okay, our next question is on a Facebook post. And can COVID testing of all Maldonians be organized in Malden in order to get clear information about the number of people that have COVID? So just in general, what is the process for testing? And, you know, in this question, would there ever be like a citywide testing?
Yeah, this would be a perfect question for our health director, but unfortunately, due to space and social distancing, we couldn't get him on the stage tonight. But I'm sure Ms. Hayes could speak a little bit to that in his absence. So
Yeah, sure.
what are you hearing the latest on testing?
So what I've heard for sure, I don't want to speak about Melrose Wakefield yet because I haven't heard a definite, but I know that Cambridge Health Alliance is testing in their parking lot for their patients right now. So I'm not sure if that's going to change or if we're going to be setting up, you know, let's see how that works out. And then if our health director, if Chris, hears of something and maybe we could kind of piggyback onto what they've already set up. So the good news is it's working over at Cambridge Health Alliance for their patients. And I'm also on a call, actually a weekly phone call where I'm going to be getting the latest from them and a lot of health directors in the area. So hopefully we'll be all keeping in contact.
So Karen, when will the Cambridge Health Alliance drive up start? I think it's imminent,
it's
right?
already started.
It's already started.
Yeah,
I
think
saw
it's
the permit come through
Yeah.
today for the tent.
Yeah,
So that would be on Canal Street,
on Canal Street.
and it's
yeah.
for their patients only.
For their patients, yeah.
Yeah, and in speaking with Mr. Webb, our health director, at the last Facebook Live forum, which was a week ago, I think, yesterday, he indicated within the next couple of weeks, he believes CVS, Walgreens will start drive-up testing. So I would ask the caller just to hang in there. I think you'll start to see some improvement there with being able to test more of our residents going forward.
I just wanted to add, I'm sorry, add that it's, you have to always call your doctor, your PCP, Cambridge Health Alliance, wherever you're going first. By drive up, we don't mean that you can just drive up and get a test. So I just wanted to make sure that was
Okay.
We did have one question via Facebook that I was able to answer through our public health director, and that is, what if a person does not have a PCP, a primary care? And the answer was to go to an emergency room and or a minute clinic type facility. So again, it would be PCP if you don't have one, minute clinic / emergency room. The next question is going to be an in-studio call, and that's from Marie. Marie, go ahead and ask your question.
Marie?
Yes.
Hi.
Hi. Mayor. Hi, this is Marie.
Hi.
I'm a senior citizen, and I want to know, I understand the restrictions of going into the stores earlier, but I depend on my daughter helping. Is she allowed in the stores with me?
Chief?
What store? Stop and Shop?
Stop and Shop, yep.
All right, I'll tell you what, Marie. Can you give your phone number? When I leave here, I'm going to go to Stop and Shop, and I'll call you with that answer so you're 100% sure. I don't see why you would not be able to. Common sense would say, if you meet the criteria, you could have somebody who is essential to accompany you.
Right.
So I would say common sense would prevail in that. It's not an absolute law, it's a store policy. And the policy is for good reason, and I would hope from that good reason comes reasonableness. Right. So what you're asking makes sense, at least to me.
Sure.
The mayor is nodding, and so is Karen, and I would think that Stop and Shop would do that, but if there's some way you can leave a phone number,
Can we do
I
that,
promise
Ron?
you I will call you
Ron?
when I leave here
Can we
and
get
go
her
to
phone
Stop
number?
and Shop.
And I'd like to add in.
I would be happy to.
Okay, she says
Okay.
she's happy to leave.
Go ahead,
that.
Karen.
Okay, great. And I just wanted to add, it sounds like your daughter is great and she's taking you shopping, but like maybe take it a step farther and have her shop without you. Seniors are the most at risk, so I'm just going to put that out there, and if there's a way that she can shop for you and bring it home, that would be the best case scenario.
Right. Good point.
Okay, our next question, I believe we covered it a bit, but I think within regards to location.
And help.
Thank you.
Thank you so much.
All right, you
Thank
hang
you.
in.
Thanks, Marie.
I will.
The question is a bit of a spin-off of the location of people that tested positive, and it's kind of a two-parter. The first one is, what exactly is the self-quarantine protocol? And then the second part of that is people are concerned about not releasing the location. And I think the chief addressed this because they're, feeling as though they're in some kind of threat by not knowing where these folks are. So maybe you could elaborate on that, because it's a very common question we get.
Okay, Chief?
Again, I'm only a high school graduate. I have no degree in science. However, from everything that I've read, if a person is affected by this illness and is in their home, they present no risk to anyone outside that home. So even if it was your next door neighbor and they remained in their home and followed all of the protocols, there is no danger. So what I think people have to really do is live based upon facts and not emotion. I think instinctively we would all like to know, but that knowledge and data really is not necessary for you to make yourself safer. The things that you can do to make yourself safer, you control. You control hygiene, you control social distancing, you control where you go. So there's a fine balance here between what the public needs to know, and I think that there is a good balance for the city to know the numbers, to know where they are. That information is supplied to first responders, because we are the ones who, by the oath that we take, are required to go to those locations if that person is in some type of distress. Right. So the city and society is drawing that delicate balance between people's rights to privacy and dignity and public safety. And right now I think those are being met in a good way.
Yeah, and the HIPAA law has not changed but for this exception. So we did look into that to find out if it had gone beyond what the chief just outlined. It has not.
Yeah, I'd like to add
I think Karen might know a little bit more, like, what does it mean when someone is confirmed and what are the protocols? My understanding, again, is what quarantine means is to remain at home.
At home. I was just going to add, what I would do is use universal precautions that first responders use. Assume everyone you meet is sick. That's what I would do. So if you think and you're walking around, and just use those precautions. So stay back from them. Just make that assumption. So I don't think that it's going to do any, I agree, any good to know where anybody lives, because you have no idea who could have been, who's sick that's walking around now. So I would just live like everybody you see and meet could be infected.
Part of the quarantine protocol that was relayed to us to answer in the Facebook questions was that the public health director, as well as public health nurses, are in constant contact with the affected, and then as a result, not only are they checking on their health and well-being, but they're also giving them instructions on who they've been in contact with and to notify those folks and those subsequent protocols down the road. So that's part of it.
I'd like to add a little, only because it happened to me, so I'll just say I can tell you how great this system worked. I had to call in the Board of Health and let them know that I was in contact with someone who could have possibly been infected, and they were great about it. I was immediately quarantined to my house, and then once that person did get tested, they weren't from this area, but they did get tested. I actually faxed or scanned in the doctor's test that specifically said it was not coronavirus, and then it went to the Board of Health, and then the Board of Health, then I had to contact the people I was in. So the system does work, I can tell you that. And then they called back and let us know when we can go out again, and everybody followed exactly what they should have been doing.
Okay, our next question is going to come to us on Facebook, and it's back to the park closures. They were wondering if they were extended to A, the Fellsmere Pond area, B, dog parks, and C, community gardens.
I'd have to look. Yes, they have. And again, it's out of an abundance of caution. If if we didn't see what we saw last weekend, different story. But based upon, everything that we were able to see, we had to take this step.
And if I can just add one thing. Has been clear in the governor's message and has been reinforced by everyone, the advisory to stay home is not an absolute legal requirement. It's an advisory for the most safe practice. However, as has been said, if people have a need to go out and breathe fresh air and to walk their dog, there is fresh air walking on the sidewalk. There is fresh air walking along your neighborhoods. But with regard to the parks that we control, we've witnessed examples of people, in spite of the fact that this knowledge of the distancing is abundantly clear, are not following those protocols. So this was something that was well thought out. It was not something that we did right out of the gate. It was an analysis of examples of not having a complete following of this that made us realize that this was still a target-rich environment where there was a likelihood of the spread of this disease. Again, though, the things that you're talking about, I want to go for a walk. I want to walk my dog. I want to go out and breathe some fresh air. There is abundant fresh air in the city of Malden. There are sidewalks. There are places that you can go. But in the interest of public health and safety right now, this is what we feel is our best bet.
I was actually going to say a very similar thing, and maybe to offer up, I know that the Middlesex Fells is open for hiking because there's more opportunity where you can space yourself apart. So believe me, I get it. I have kids, and being stuck inside with them is no fun. Well, it's a little fun, but then sometimes you're just getting, you need to get outside and get fresh air. So I also wanted to point that out too. You should go out for those walks and just make sure that you're giving yourself a lot of leeway to pass people when you're out there.
Yep.
Okay, so just a couple of things. First of all, for the woman who you said that you would call back, the wonders of technology, her daughter has reached out to us on Facebook and provided her phone number, so I'll provide that with you,
Excellent. She'll be hearing from me tonight.
So that's great. Thank you very much, Amanda, and we will get that message to
Thank you.
Marie. One point of clarification was that the drive-through clinic that CHA was that was being discussed earlier, it's not in the final stages, it's purely in the planning
Yeah,
stages.
that's what I thought.
Our
Because I saw their
inspectional
permit
director-
application come through today,
Okay,
right?
yeah.
Okay.
Just a clarification
Thank
there. We're going to check. Do we have any calls right now? Okay. Okay. So we have a call from Vicky. So
Okay.
Vicky, if you could please.
Hi,
Go
Vicky.
ahead.
Hi, Vicky.
Hi, Mayor.
Hi.
Yes, I have a question. I'm a senior citizen in Malden at Pleasant Street,
Okay.
and I usually go shopping at the beginning of the month with the ride. Is that okay, or should I have one of my children drive me?
Nope, that's okay as far as I know. Do you know anything differently, Chief?
No. Again, as Karen had said to another caller, there is probably a safer way to do that. And the safest way, if your daughter is able, you tell her what you need, give her the list. She can go purchase the items and get them back to you. That way that limits the number of people that are out and about, and it limits you going out and potentially being exposed either through contact from another person or even contact with a surface.
Right.
So
Yeah,
that
that's
would
where-
always be the best way, but there's nothing that prohibits that from
Yeah, if
from
you have
occurring.
no other option, it is still allowed under the stay-at-home advisory.
As far as I know, I have seen the ride,
The ride
in
is still,
effect.
yeah,
so.
the ride is still working, and
I was just wondering if I could go with her.
Yeah, again, I think they're
Again.
recommending you don't, but if it's absolutely the only way, then you can.
yeah. I was going to say too, just it's really a good time to remind people of that neighbors helping neighbors, which the website is on the City of Malden's the front page. So if you can't get out, somebody else can't pick it up, you should sign up for that. Actually, you should sign up for it now, just in case you need something else. So on there are volunteers who
talking
said they
like
would be
people?
willing to go shopping for
Okay.
people, picking up their prescriptions and anything else they need. So everybody should kind of sign up now, just in case, even if you don't need it, so that you know that you're in the system.
Okay, so we did see the website there and those links, along with all sorts of information about coronavirus is all found on our front page. There was
hang in, Vicki.
Thank you, Vicki. There was a question that was called in, but they didn't want to come on live, and the question was if they were unable to get testing through their PCP, would the city be able to test in any capacity? We've already answered that question. I can address it. I just had this discussion with Public Health Director, and the answer is no. Under no circumstances the city Public Health Department doing any testing. Their primary role in this response is in the monitoring and dissemination of information about it. Testing will be done by PCPs and emergency rooms. If that changes, that will be made very clear to the community.
All right, thank you.
Call first. Call before you don't just show up the emergency room.
Okay, so we have a question now from Barbara, and Barbara, go ahead and ask your question.
Barbara?
Thank you. We're seniors and we live in a hello?
Go ahead, Barbara.
Okay. We live in an apartment building.
Okay.
And there are hundreds of residents in this area. So we're wondering if someone in our building had the virus, and how would we be aware of that? Because even if they're quarantined, they can still be in the building, but they have to go down and get their mail, touch the elevator buttons. So how do we control what's going on in a big building?
Well, generally, let me say something that's been said before. I think that you have to look at every environment that you are in as being a potential hazard to you. So when you say an elevator is always going to be an environment that someone touched that could have spread this, virus. When you go down and get your mail, you have to look at the door that you're opening as something that is potentially harmful to you. So the things that you can control are, again, hand washing and social distancing. And if you do those things, you would be greatly, greatly protecting yourself and others from becoming exposed to this. So if you treat every surface that you're touching and every person that you are near, hopefully 6 feet or more from them, as someone who you are a risk to them or they are a risk to you, that doesn't mean paranoia. That doesn't mean a lack of love and human citizenship. It just means safety. So again, I keep reinforcing this notion. Knowing exactly who a person is and where they are if they have this illness does not really act as the requirement that you need to take care of yourself. Yourself, you take care of yourself. And you do that by maintaining these good standards and practices that will help you. So again, the law is for a good reason. It has been relaxed to recognize first responders protection. And this is where we're at right now. But again, I have to urge you that just knowing that someone has this illness is not an absolute protection against you becoming ill yourself. You have to look at every surface and every person and every situation that you're in as something that you have to protect yourself in by taking measures, by washing, using hand sanitizer, and maintaining the distance.
Well said. And Karen, do you want to add to it?
Yeah, so if you have to go down, I'm just going to keep pushing that.
We do all of that anyway. We do all of that anyway, but how do I know if someone just got on the elevator or got off the elevator that sneezed and coughed and all those germs are flying around?
I wouldn't get on an elevator with anybody if I couldn't maintain 6 feet of distance. So that's something you have to decide. Is it an inconvenience for me to wait for the elevator to not be as full? Yeah, it's an inconvenience, but it's also something that is very important to your health and your wellness. So you have to draw a balancing act between convenience and your safety. And I think your safety should always be what drives the decision during a time like this.
Barbara, hold on. I'm
Yeah.
going to have Karen say a few words.
What I was going to say, Barbara, is during this time, what I've seen is people just coming together and helping each other out. I guarantee you, if you ask someone if you're really worried about going down and getting your mail, people can pick that up for you. Or maybe even between you and your friends, like you were saying, just have one of you go down a day and pick it up. Use gloves. So if you're really worried about touching things, put on gloves, and that is even more of a protection. Then still wash your hands. But, you know, you could set up things like that so that you're only, you know, going out as little as possible, especially till this is over. It's really just helpful to stay in the house.
Thank you, Barbara.
Thanks,
Barbara,
yeah.
be well.
Thank you.
Thank you, Barbara. And we had a really important clarification that was given to us by a healthcare professional via Facebook, and that is, if you do feel like you have symptoms and you've been advised to call your primary care or emergency room, definitely call before you go, because they will give you a specific set of instructions and protocol on how to even approach the building.
Okay. You mentioned that, right?
Yeah, definitely.
So we just wanted to relay that,
Always
and that was
call.
great information. Thank
Yeah.
you, James, on Facebook.
Thank you, James.
So we have another question, probably time for a lighthearted one at this point, and that is, any change to takeout food? That's from Chuck on Facebook.
Okay. No, right?
I don't know of any. I think that restaurants that provide takeout have been advised to maintain social distancing.
Right.
Do not allow the line to become such that it's unsafe within social distancing. Reassurances to the public that they maintain good hygiene within, which the Board of Health does everything they can to ensure all year long.
And you've been spot checking different
Absolutely.
places, right? I saw a Bikini Cafe today on Summer Street had a table.
Yes.
Then you step up, then you order,
Right.
and you exit left.
Right, so I think what these places are recognizing is that customers are only going to go there if they believe it's a safe environment, and you create that belief of a safe environment by showing real, tangible proof that you're taking it seriously. And as the mayor said, you go to a place where you can only go in one at a time, you place your order, then you maintain distance, you get your product, and you leave. All of those things allow for the safe delivery of a product in a way that is good for the public, and allowing some businesses, not all, to maintain some viable economic.
And I know Kevin Duffy, our business development officer, has been pushing the availability of all the restaurants, the takeouts in our city. So if you go to cityofmalden.org, there's a page dedicated to who is doing that during this crisis.
Right.
I'd like to add into, I can say through my kids at home that Uber Eats is out there too. So I'm just putting that out
Right.
there because I'm getting ridiculous amounts of deliveries from the kids being at home.
Yeah, and if
so
you
can get a lot of stuff
and
delivered.
if you see someone that is not happening, please let us know at 781-397-7000, or you can email info@cityofmalden.org. Is that address info@cityofmalden.org?
Okay, we're just about to go to Mary on the line, but before we do, we did have a quick question. It's a quick answer. Kev asks about the public drinking water supply. We've recently received a notification from the Massachusetts Water Resources Authority confirming that there's absolutely no risk to our public drinking water supply. So I think it's a quick answer. That was a
Yep,
good
that's
question,
correct.
and I
Yeah,
wanted to
good
get that in. Okay, so Mary, we have a question from you.
Hi, Mary.
Hello.
Hi.
Mary.
Hi. Well, thank you very much for allowing me to I have a question.
Okay.
Okay, first I want to thank Karen for mentioning the gloves to Barbara. Thank you very much, Karen. You did
Welcome.
a great job at the senior center.
Thanks.
But if they don't have gloves, have them put on saran wrap,
Yeah.
or the baggies.
Yes.
Let them wrap them around their hands. You know that, Karen.
Exactly.
Yeah. Thank you very much. I have a question for I guess it's going to be to Gary.
Okay.
Thank you for putting this on tonight.
Yep.
It has to do with I'm a senior citizen, and I live up in the Maplewood area.
Okay.
And it's going back to the 9 confirmed cases.
Mm-hmm.
Could you tell me, and I understand all about the HIPAA laws, could you tell me if this is community spread, or was it domestic travel or international travel
involved? Because it sounds like it might have been, I don't know, like if we have 21 people that might have been in contact. So was it someone that traveled?
You know what? Maybe James can do it. Yeah.
All right, Mary, so what we know at this point, 9 confirmed cases, one of which emanated from the Biogen conference, which I think we've all heard about.
Oh, yes. Okay,
Right.
yes, I understand that. Yeah.
And then the other ones, we think a hospital employee, and then the rest were just interpersonal contact. The good news is, Mary, that all of them from the outset have been cooperating with our health department and our director, Chris Webb. So none of them have, blown it off and, decided to hold back on telling us. They've been in touch with us. We've been in touch with them. And, again, all the protocols are being followed.
Oh, no, I understand you have it under, yeah. It's just that, I mean, because I'm not going shopping. My daughters are doing it. They don't even come in the house. They slide it in the door for me. I was just very concerned about that.
Yep, we understand.
Because I'm a senior citizen, and I love Malden, and I feel so bad.
Thank you. Next time we're going to have you as a panelist, Mary.
You know what?
I mean, you're doing all the right things. I mean, I think...
Actually, I was a community activist and community... So, and I met Karen down at the senior center before. So, all right, I know you've got a busy night, and all of you just stay safe.
All right.
Thank you.
Thank you.
Thank you very much.
Thank you. Bye-bye.
Okay, our next question comes from Facebook, and this question is from Deanna McMillan. And well, first of all, before she asks the question, she does want to commend the panel and all those that are involved, and thank you very much for helping keep us safe. The question is whether or not Stop and Shop and other stores who are doing senior hours, whether or not that could be extended to those who are immune compromised.
Right. I saw that direct message today, and I'm sorry I didn't get back to you sooner. I was working on that, and I think our police chief is going to speak with Mr. Allen over at Super Stop and Shop to see whether or not there can be, some type of accommodation made.
Right. The only thing, instinctively, I would say, if someone is immune compromised, just to reinforce something that Karen has said, I think there are probably some better alternatives that can keep you at home and allow us to help you. And this would be a classic example of that, where someone who has, a compromised immune system should take advantage of the fact that there are good people out there that want you to be healthy, they want you to be safe, and will do everything they can to facilitate things that you might need, whether it be food, medicine, walking your dog, or whatever, and that can be done in a very safe manner without any face-to-face contact.
So
I saw an excellent video from the Israeli Defense Ministry about that, encouraging grandchildren to hold back the urge to go visit grandma and grandpa and hug them. The best thing you can do is leave them alone, make sure they have food, and things of that nature. So the urge to express our love in the traditional way has to manifest itself in a distant way right now, and we would be willing to help you with that.
So Deanna, let's have you hook up with Karen at Hayes, KHAYES at cityofmalden.org, because I think based on what they're saying, this probably is the right way to go.
Yeah, there's so many great volunteers out there. I know so many of them personally. There's also organizations who have signed that up. So like, the Bread of Life is on there, and Mystic Valley Elder Services. There are people on there that are doing this for their job, so they're also volunteering. So I definitely, especially if you're, have an autoimmune issue going on, I would stay at home.
Yeah, so let's try that, and if I know Karen, she'll find a solution. If not, just circle back with our office, and we'll see if we can come up with a plan B.
And Deanna, I think I saw you today at the car accident. And I had to admonish her to stay back 6 feet. So even you got to kind of leave the cops alone when they're doing their job. Give them 6 feet. So.
Okay, so our next question is coming from a phone call, and that phone call is from Paul. Paul, go ahead, and you're on the air.
Hi, Paul.
Hey.
How are you?
I'm good, thank you. Mayor Christenson, Chief, everyone, thank you for being there and presenting this. It's been very informative this evening. Thank you.
Pleasure.
My question is, town offices, they seem to be open, and I left a message for the clerk's office today. Unfortunately, my mother's passed recently, and there are certain birth certificates and whatnot that we need to get from the offices in a timely manner. Is there going to be a way for us to call in, pay by credit card, and maybe have those documents mailed out?
Yes. Yes. So you called well, first of all, our condolences on behalf of everyone.
Thank you.
So you called the city clerk's office today and left a message?
I did.
Okay. When did you do that? What time around? Do you remember?
Oh, might have been midday.
Okay, yeah. They're pretty good at getting right back. So if you don't hear anything by tomorrow morning, which I'm sure you're going to, call us at 781-397-7000, and we'll work to make the assist.
Thank you. I was also thinking that, you can always mail excise taxes and other things in as well, but any type of online Malden store, so to speak, that might be able to be set up so that they could, like we pay our water bill and so forth, if all those things are available, I think that'd be something else that might be publicized to the community so that they have access and knowledge of those websites and online abilities.
Yeah, which I think we do at cityofmalden.org. Ron, is there a section where...
Pay bills online. I think what he's referring to are services that are not yet available for online transactions. I think he was suggesting.
I know where the section is, but I'm just saying that maybe we need to advertise it a little bit more during these times.
Right. No, it makes sense. Okay. Our communications director's here, so he's making note of that, and we'll see if we can do that going forward. I know one other thing that they have done through our public facilities department in the treasurer's office. They now have it's called a lockbox, I believe, where customers will have the ability to drop off payments in that manner as well. That's been in effect since Friday.
And we do
Thanks, Paul.
Thank you, and I hope you all stay safe.
You as well.
Thank you.
You too.
We do want to remind everybody, too, that on our website, if we could bring that graphic up, there is a page that's on the front that is, it's got a lot of resources, one of which is the City Hall status page. And what that is it's a bulleted list of all the city departments and what those services that they are providing, because clearly not all services can be provided. So we wanted to make sure that people not only see what services are being provided, but then also give people a direct access to get in touch with those departments, as well as calling the main number, which is 781-397-7000.
Could I, about that website, so on the top of the website, you'll see something, a click on for social services. I just wanted to put out there, because it sounds like there's a lot of people who are home, where you should be, but there are all sorts of services there. There's faith services there. A lot of our faith groups and churches have been doing services online, and even just like an open chat where you can just call them, but they are doing that. So if you're home, it does feel really good to be like connected with people in that way. You can see somebody, you can do it on your phone, or you can just call in. So check that page out.
Okay. And Karen, the same goes for the library. I guess they essentially have moved their operation online.
Yes, online. And library books, you can get in online. I think they're giving out now new library cards very easily, so you can just kind of sign up and get books online and read them that way.
Okay. All right, next question.
Yeah, we'll bring up that graphic to show what Ms. Hayes was just referring to, which is our city website, and it's business, healthcare, and all other non-city services status. So if you click on that, it has various things that were, statuses of businesses, restaurants, and social services, things like that, and that's being updated regularly. So we do invite residents to do that. So we're getting that graphic. Okay. We're getting a lot of thanks, so I think it's important to say that. We're really, there's a lot of folks that are expressing their sincere gratitude here for having this forum, so we do want to acknowledge that.
Well, thanks goes to everybody that's here tonight. Again, MATV, soon to be UMA, Maria Luisa, our Chief of Staff in the Mayor's office, you, Ron, Karen, Chief. Thank you all for taking time to be here tonight.
Okay, this next question is whether or not things like bus stop structures can be made safer, because those seem to be areas where you can't avoid social distancing based on the size of them.
Well, I will tell you this. not only locally, but I think nationally, ridership on public transportation is down. So I think also, maybe unwisely, sometimes they have reduced the number of trains and what have you, which can then take that smaller number and actually concentrate it a little bit more. But again, I think that this is another example where you have to approach a bus stop and make your own assessment about it. Fortunately, we're moving into an environment where it is not brutally cold. You don't need to be enclosed against the wind. So I think if you look at a bus stop and assess how close people are together, you can make yourself 6 feet away and protect yourself. However, what I've been doing, and I think anyone out in the public in an official capacity could do, if you did see unsafe concentrations of people, I think education is the best form of enforcement, and to maybe tell people they should separate a little bit is a little bit of a helpful reminder. However, those that need public transportation, it's essential to their life if they have to get to an essential job. But again, the bus stop itself only becomes risky or hazardous to you as a person if you put yourself in that environment. So again, approach it like anything else. Yes, sir. Before you put yourself in a certain position, you assess it, the distance, and all of those factors, and you put yourself in a safer place.
Okay.
Yeah,
Karen?
I would just say, like, now is not the time to feel like self-conscious about speaking up for yourself. I know it's kind of awkward to say something like that, but if you can just say, I'm sorry, I think we're a little too close right now. You know, the requirements are 6 feet, or I just want to stay healthy. It is, yeah, now's not the time to kind of sit there and have somebody brush up against you if you're not, you know, feeling safe, because maybe they forgot. I know sometimes I forget what we're doing. I almost want to go out and give someone a hug, and I have to remind myself. So, I mean, just feel free to speak up. People will appreciate it, I'm sure.
Okay.
Okay, once again, more appreciation coming through. Information, I think, is really helping folks to get a better handle on this, especially at the city level. The question that was called in, and the caller decided not to come on, was whether or not the library would think about maybe delivering books to folks. Specifically, they asked about to seniors.
Yeah, let me just look to my right. We heard something on that today, right? What's that? Okay. They are looking at that as we speak, and that's something that they may do in the near future.
There is also on the I'm going to keep pushing people to that website, because there is a book share on there too. So that's the
so where do they
neighbors,
go, Karen?
the neighbors helping Malden neighbors on the city's website. Go ahead and fill that out, because people were thinking about that too. So there's book shares, there's game shares, there's all kinds of things. They like really thought of everything. They did a great job.
All right. And if you can't find it, which you know, just give us a call at 781-397-7000.
Okay, we once again have Marie on the line for another question. Marie is on the phone again.
Hey, Marie.
Hi.
Hi, me. I'm sorry. I have one more question.
No problem.
Okay. Those of us that were very active in the Malden Warming Center, should we be tested? And should we take certain precautions?
Chief?
I don't believe that there is any indication that anything connected to the warming center presents any current risk to anyone who went there to receive services or served as a volunteer. What I would say to anyone is that if the symptoms are manifesting themselves in your life in any way, that should drive your determination. But I can tell you right now, we have no information that anything connected to that warming center presented any examples of this virus to anyone.
And which has closed since this crisis came down.
Yeah,
Thank
unfortunately.
you so very much.
Okay,
I'm just
Marie.
going to add, Marie, that just to put your mind a little bit more at ease, that honestly, the homeless population is probably your least worry. You know, they haven't been traveling, most likely. I'm just going to assume that, but I have also been stopping in and trying to keep in contact with a lot of the people who don't have a place to stay now since the warming center has closed. So they're still out there showing no signs. I've checked in with them, but honestly, I think that that's probably not a place where you would have gotten it.
Thanks, Karen. Thanks, Murray.
Thank you so much.
Okay, just to remind folks, we're at 8:15 now, so we'll continue. We still have a few questions coming in. They're winding down just a bit. But next question is from Facebook, and it's Melissa asking, are cemeteries also closed at this time?
I do know that there's a limit generally on funeral services to that 10, no more than 10 people. And some faiths are not even having, funeral services for now. With regard to the cemetery, I'm not sure if Mr. Cahill has been...
Yeah, let's have them contact our cemetery director, Jim Cahill, at jcahill@cityofmalden.org. I don't have their phone number on me. But if you can't get a hold, call us at 781-397-7000. But this latest order from the state does impact even funeral services, so it is limited to 10 people.
Yeah, no more than 10.
Right.
And, maybe it can become prominent in the website as we've now gotten into this period of time where it's having an impact on somebody called in tonight indicating a recent death in the family for, documents. So this is something that obviously the city is attentive to.
Yeah, so our communications director, he'll make a note of that.
Yeah.
Okay, our next question is a phone call, and that's from Brett. Brett, go ahead. You are on the air.
Hi, Brett.
Hello.
Hi.
Hey, how's it going?
Good. Hi, Brett.
Hey, my question is a result. Can you turn that down? Okay. Basically, I'm working less hours now, and my wife, she's looking for a job, and all the jobs have been put on hold that she's been looking at. And we just received notice that our rent is going to be increasing quite rapidly, or increasing quite a bit. And because of the COVID-19 stuff, financially we can't afford these increases right now. Is you looking into any type of situation to try and help out people like that might be affected financially here in Malden?
Yep, and we've been doing that through our state delegation and our federal delegation, who have the capacity to be able to intervene on that. And Senator Lewis, a week ago yesterday at our Facebook Live forum, said that was something that the state was seriously considering. I'm not sure what level it's at right now, but I think there was even, I don't know if there was a bill drawn up, or there's been some back and forth between Governor Baker and the legislature on coming up with something. If you can, offline, drop us, an email. I'll try to get you some of the specifics of it tomorrow.
Okay.
And you can reach us at info@cityofmalden.org. That'll go to our communications director, who will then confer with me, and we'll try to follow up as best we can on that. But I know there's been a lot of talk at both the state and federal level on doing something.
Yeah. I mean, if anything, it'd be great to see these increases not go into effect.
No doubt.
Just to help us out a bit.
Yep, we agree.
Yeah, I was just going to say, did I hear if there was an unemployment issue, if someone just lost their job? I know I just got something from mass.gov today that you can go right online, and there's step-by-step guidelines on how to file a new claim. It's in different languages. That's for anyone out there who they're making it even easier to do. So if you go to mass.gov, you can file a claim right online.
Thanks, Brett.
Okay. Thank you all.
Send us that email tonight, and we'll follow up first thing.
Okay, we're still perusing through some questions here. It might be time for a quick update, but we're still looking for questions right now. No questions at this time, so we're continuing to comb through. We have, just to remind everyone there at home, we have the number that is to call in that's being listed below the visual right now, which is 781-388-9394. I was corrected. That's the lower third graphic. And anyone that'd like to call, they would ask their question in studio. And the next way is through our Facebook page. You can either drop us a line in the thread that we posted about this, as well as send us a private message if you didn't want to have your question relayed. So we're getting calls now, so we're just waiting for those questions to catch up.
Could I just jump in? So for all the youth out there, I just wanted to also, I've been getting some questions about the Mayor's Summer Youth Employment Program. So right now, we have canceled the interviews that were scheduled for the April break. So that's been canceled, but we're still accepting applications. We actually extended that. So you could also go on that on the cityofmalden.org, and then Mayor's Summer Youth Employment Program. And we're continuing, like I said, to take those. So we haven't heard anything from our grantors or about cancellation. So far, we're going to still move along and hopefully have this program in the summer.
Yeah, I just want to, at this point, thank you, Karen and Kelly Collin, publicly, because this is one that I think most would have understood if you said, you know what, we're going to either push it out or cancel it outright, and you've been determined to try to see as many of our youth still have the opportunity to go to work this year, so hats off to you.
Yeah, actually, speaking of Ms. Collin, so Kelly Collin has, we're actually still running the year-round program, and she's actually figured out how to do that online, so it's been great to watch the kids all calling in and doing their classes online with Zoom, so that's great. Thank you. Yeah.
Can I just, kind of important police and domestic violence related courthouse thing. Obviously, we're in a whole new world here right now, so a couple of things I want the public to know. One of the things we've done for their safety and the safety of the officers is, in order to limit some face-to-face contact, certain minor incidents are now being reported on the telephone. So the police are no longer required to come to your house, or you're no longer required to interact with a police officer. Person to person in things like minor theft, harassing phone calls, and there's a whole list of them. But the way to report something online is to call 781-397-7171. You would then be prompted to hit 0, and then you would speak with a police officer. If it's something that can be reported over the phone, it will still result in a police report being written, but that will minimize the amount of person-to-person contact. Secondarily, this series of events has had an obvious impact on the way that the court system has been able to operate. But I want people to know that the criminal justice system continues to move forward, again, each and every day evolving. But in the most important area of domestic violence, issues like restraining orders, harassment prevention orders, and things of that nature, victims of those type of situations, I want to reassure you that help is still available and the means are still available, and it's something that can be done through the court. Sometimes it can be done over the phone with an advocate, but I just want to reassure the public that their access to protection under the law is something that is being addressed by the court and through the criminal justice system as best we can.
Okay, great.
Okay, next we have another phone call that's come in, and that's from Eileen. So Eileen, go ahead. You are on the air with the panel.
Hi, Eileen.
Hi.
Hi.
Your question, Eileen?
Eileen?
Hello, thank you first, everyone, for being willing to do this.
Sure.
I just wanted to, my primary care does think I might have it, but she cannot offer me a test at this time. And so I will not get entered into any kind of database because she would have to give me a test to do that. Right. So my question is there any place within the city that's trying to keep track that I could call to let people know that I'm a potential case, but you're not considered presumptive unless you've had a test, and she can't offer me a test.
Okay. Yeah, we would recommend contacting our Board of Health.
Go
ahead.
Thank you. I did do that, and they had said that they have to rely on the official report from the doctor.
Oh, okay.
How do you feel right now? I mean, do you feel that you need medical attention?
Wait, do you have a phone number?
No, I'm being followed. My doctor is on it, and I have to keep her updated, but I'm not severe enough to be tested. The only people who she can give tests to are if I was on the way to the hospital or I was a health worker, are the criteria that she's following, so I don't fit that. But just do feel like I just thought it would be maybe helpful to people in the city just to know there could be other folks like me who the doctor said she can't enter me into the database unless she has given me a test.
Yeah, Eileen, have you been in touch with the State Department of Public Health? Have you tried them?
No, I did call Malden.
Yeah, let's try the State Department of Public Health. Maybe they have better information than we do, you know, at the local level. We're trying to dig up their phone number right now.
I've got that phone number. Mass DPH is 617-624-6000. Yeah, again, Mass DPH is 617.
I'm happy to look it up.
Yeah, 624-6000.
Okay.
Yeah, that's
Did you want to add something?
Yeah, because that's sort of the situation where I was in too. So I was told the same thing. If they're not going to test you, right, unless you're been in follow, you know, all the criteria you meet, not just feeling sick or being around someone, but you could ask your PCP. I know in my case, the person that I was with actually tested positive for the flu, which meant that they didn't have the COVID-19. So I don't know if have they tested you for anything, and then maybe you can just call them back over there. But it comes down to everybody's assuming that you have it, and you just have to stay home and unfortunately and quarantine yourself, assuming that you have it. But if you need help while you're doing that, go back onto the city, you know, the website that we're saying, and we would love to help you out.
Yeah, I've been following all of that protocol for.
I mean, for help too, though, if you want to go on that site that I've been talking about, Malden Neighbors Helping Malden Neighbors. So if you are home, and people can help you out with things that you might need. Yeah. That's tough. It is tough being home like that.
And I know, Mr. Cochran, you provided the State Department of Public Health phone number. Can you do it one more time?
Yeah, I'll repeat that. It's 617-624-6000.
All right, Eileen, hang in there, okay?
The left link is translated. It says translated pages or translated messages. Okay, so the next question is from Rachel, and Rachel asks whether or not...
Thank you, Eileen.
Oh, thank you, Eileen. Sorry about that. Rachel asks from Facebook whether or not we have resources for non-native English language speakers that are receiving clear information and guidelines regarding social distancing, hand washing, etc. So what resources do we have?
Well, let's have you speak to that. I know we've been meeting internally on trying to come up with ways to do that, and I know you've made some progress this week on it.
Yeah, so we should be able to bring this up on the screen now. So what you're seeing on screen now is something called Translated Messages on COVID-19 Coronavirus. So we're going to really start ramping this page up, and the idea here is that as we translate the different messages, we're going to put those in. What you're seeing there is the 5 most common languages that we translate these messages in. We can always do other languages upon request, so if you email info@cityofmalden.org, happy to translate into the language of your choice, but what you're looking at there is simplified Chinese, Haitian Creole, Brazilian Portuguese, Arabic, and Spanish. Right now, the 2 messages that you see are the two messages that were previously given by the mayor and the fire chief, which were COVID-19 updates, and the 2 other panelists that are on the stage will be delivering their updates remainder of the week, and those will be posted as well. We're also going to start bubbling up, and I think it's a great suggestion, some of the common multilingual documents that have been going around, which are, social distancing, proper hand washing, things like that. So I'm going to work with the public health director to bubble those up to this particular page that are the
and
the
please
page
let
that you
Rachel know
previously.
both our police and fire departments are well equipped, because we know they're going to be called during this crisis quite often to meet all of the needs within our community.
Yes, sir.
Yeah, in addition, we did find out that the police has a service for translation. Fire department also has access to translation services as well, and City Hall as well. So if you were to have a person who was to call and need access or need anything explained, we have the ability to get a live translator on the phone in just about any language. So we do encourage folks to call that, having that. But most importantly, we're speaking English, so people aren't understanding what we're saying. But what we've been asking is those who are bilingual, please relay this important information to folks that you know that don't speak English. And that's super important for us. We can only translate so much, and these things are so important. So if you're bilingual, please relay to people that are English language learners. And also anyone that is not necessarily tech savvy, that cannot visit our website. We say if you see information that's posted on one of our alerts, please relay that as well. Okay, I think we don't have anybody on hold right now, so we're going to... Oh, we do. I'm sorry. We have Diane. So Diane is going to be asking the next question. Diane, go ahead. You're on the air, and you ask a question of the panel.
Good evening, Diane.
Hi, Mayor Christenson. Yes, you have people on the feed that you can't see here asking about the pay-as-you-throw program. Will that still be enforced?
Yes, as of now. We've been meeting on that internally, and right now there hasn't been any issue with the delivery from our vendor, nor with the stocking in our stores.
Wonderful. I support this program. So those are available in the grocery stores?
Yes.
Great. Thank you so much.
Well, I should probably end the show now. But we are looking at helping those who cannot get to the stores by actually having our employees deliver the bags to our customers. So, for instance, Kathleen Manning Hall, I think over the past couple of days has made a couple of deliveries. I think Kevin Duffy's been involved. So, you know, we're going to do our best to work with our customers to make sure that, you know, we're able to continue the program.
Wonderful. Thank you so much.
Thank you.
Stay safe out there.
All right, you as well.
Thank you.
Thank you.
Okay, some folks tuning in late that would like maybe to reiterate what the numbers are in Malden for positive cases, and that was from Diane.
Okay. The cases that we have as of yesterday are nine confirmed COVID-19 cases. And we believe that they're from interpersonal contact. That's what our public health director, Chris Webb, has told us. Again, all of those 9 confirmed cases have been fully cooperating with our health department. All quarantine protocols are being followed. But again, I think what everybody should prepare themselves for is that these numbers are going to increase as testing becomes more available. And we also have, as of yesterday, 57 presumed cases with an additional 21 people who are being isolated due to their interaction with those individuals. So I think our next update is set for midweek. I think it might even be tomorrow afternoon. We might get a new round of numbers, and we will do our very best to let you know what those are as soon as we receive them. But in the meantime, I think, you know, Karen and our police chief have said it perfectly tonight. Treat it like everyone is. You know, when you know, stop watching the show tonight, I think you, if you haven't already, I would get into the mindset of, you know, everybody has it, and therefore, what do I do about it? And, you know, what they said tonight, just every precaution possible.
Okay, next we have a phone call from Janet. Janet, go ahead. You're on the air with the panel.
Hi, Janet.
Hi. Hello?
Go ahead.
Hi. Oh, I'm sorry.
No worries.
My question to the panel is, my niece-in-law lives in another town, and they have some service where you call ahead to grocery stores and you can pick up curbside. I wonder if there's anyone in Malden that's doing that.
Yeah.
Anything you know of, Chief?
Stop and Shop does have Peapod.
Yeah, I thought, no, they don't have Peapod here, but they have curbside. I thought they have where you
a couple
pull
little
in.
spots, right.
Right.
There are a few
Yeah,
spots.
Super Stop and Shop offers that service. I don't know if it's been discontinued, but they unveiled it this past summer, where you can call ahead. I actually tried it. I didn't do well, but you can go online and pick your items and hit submit, and then you pull up and someone runs them out. Now, I don't know if that's changed during this crisis, but I think a simple phone call to them tomorrow will...
You know what I'll do, Your Honor?
Is that
when I leave here...
No, it's not Peapod. It's, I forget the name of the service. It's essentially, you call it in or you order it online, and then you pull up or someone pulls up in a designated area, and they'll run it out to you and put it in your car.
Maybe what I'll do, where this is so important, and we do have one major supermarket I'll speak to the manager and I'll connect with Ron, and maybe we can link up what available services they have.
Okay.
Okay?
All right, Janet, so you could call them in the morning. Our police chief is going to take it upon himself to speak with them as well, and you know, we'll go from there.
Okay, thanks so much. I
All right.
appreciate it.
All right, Janet.
Bye now.
There are some popular services like Instacart, which go against you know, many different grocery stores. So it doesn't necessarily have to be the grocery store that is in your city. They will source from other cities and deliver to you. So
Well,
Instacart is one
maybe
of
we
those.
should add that to our website.
Yeah, we'll go ahead and work that out.
Yeah,
work
first
with-
let the chief have an opportunity to speak with Mr. Allen over there.
Yeah, we always like to keep the business local, but
Right.
we'll find that out. Okay, I think we're waiting on a call now coming in, so we're just going to wait a second on that. And we have Joan on the line, so
Okay.
go ahead, Joan. You can ask your question.
Good evening, Joan.
Hello.
Go right ahead.
Okay. My question is, are seniors threatened by other seniors, especially in a senior building where there is a lot of traffic and coming in and out to go to the laundry room or the trash room?
Right. I think if you could
Same
repeat,
thing,
because I think it's important, Chief.
I think, yeah,
Do you want to go first, Karen, then Chief?
Yeah, if continue to assume that everybody else has something. I mean, that's the safest thing, because then you're going to make sure that you're keeping your distance. And also, we've talked earlier about maybe wearing gloves, if that helps you. If you had to press an elevator button or the buttons on the washing machine, bring wipes with you. Wipe it down before you use it. Just take all the precautions as necessary. So seniors are most at risk, and hopefully, fingers crossed, everybody's taking heed to all the warnings and staying home. I'm hoping that it's the least likely person you're going to get it from, but I would just keep using, you know, every precaution that you possibly
Yeah, and I
could.
know Karen's been in touch with Steve Finn, our executive director, and I know they ramped up their cleaning.
Oh, yeah,
in all the buildings. I'm
absolutely.
not sure if she's in one of those, but
Yeah.
Chief, do you want to reiterate?
Yeah, again, I think any environment that brings people closer together is a more risky environment. Just to illustrate that, police begin their shift by having roll call. We have moved our roll call for now into a bigger room so that the police officers at roll call, before they go out on their duties to protect and serve, are now in a bigger room so they can be further distance away from one another. So it's everywhere. Anywhere there's an environment which brings people closer together out of necessity. You live in a building that has elevators, that has a common laundry room, that is a more target-rich environment for exposure. That's why in that type of environment you have to take added precautions. You have to be attentive to things like buttons on the elevator, washing your hands, how many people you get on an elevator with, how close your distance is to people. All of these things are things that you control. You control all of those things by the lifestyle that you choose, and I ask you to adopt healthy practices now and moving forward, and that's the best thing you can do. The more healthy you can make yourself, the more ways that you protect your health makes us all healthier. So that's why there is a commonality to this. There's a mission here. We're all in this mission together, and the main mission we have is to protecting our own health, not necessarily for selfish reasons, but also for the good of everyone else. So for the good of your building, for the good of the first responders who have to respond to calls, we're encouraging everyone to stay healthy, especially the mayor. We can't have him get sick. Just think of what would happen if that would have happened.
That's not what some would say.
So, but I'm just saying, we all have a responsibility to this, and not everyone is going to act with the same level of responsibility. As some have said, people are in lines that are closer to one another. But as Karen has said, the opportunity here is you can assert yourself more nowadays. I'm not asking you to become aggressive, but you can decide to tell someone, you're close enough to me, don't come. And people are understanding that. People are understanding
It
that.
happened to me on the street today on the way to work. Someone came over as they normally would.
Right.
And I asked them just to
And
stay
that gentle
back.
reminder,
Yeah.
I find no one taking offense to it. It happened to me at a traffic accident today. Someone wanted to just come over and talk. I said, we can do this from 6 feet.
Right.
And they said, you know something, you're right, I forgot.
Joan, ideally, if you can, stay, within the place that you live, that's ideal. But if you must go out, as Karen and the chief have been saying, take every precaution.
And as the mayor said, Mr. Finn, Steve Finn, has done a remarkable job. He's someone that we're in contact with. And if I can just mention one thing, the city of Malden has a great emergency management team. They're around year-round. They meet monthly. Captain Glenn Cronin from my agency is the director. He's helped by Bill Sullivan, the chief of the fire department, Chris Webb, Bobby Knox, Peter Dolan from the schools. And they meet every year, hoping that they are not needed. They try their best to plan for everything. This is a time when their planning and their collaboration really comes together in a good way, and everything that they plan and prepare for comes into action. So we're very lucky that
And
we
they
have
meet-
this
they're-
group.
They're meeting every month.
Yeah.
So, again, Captain Cronin, thank you for everything you're doing. All right, our next call.
Yeah, so we have a call coming in, but before we do that, thanks to folks that are paying attention and trying to get answers for us while we're up here talking, which is great. So we've been reminded that Stop and Shop has discontinued curbside
figured that.
pickup
Okay.
now for a while. That was Jessica and Lisa.
Was that discontinued because of the crisis?
It wasn't made clear.
Okay.
Yeah, but it had been discontinued for a while. But I would probably be implied that was the case. Lisa points out another service, Amazon Fresh, which is another online service. So thanks for all those tips.
All right.
So again, we
question?
Yeah, we do have a caller. The name of the caller? Okay, so we got Patricia coming on. So Patricia, go ahead and ask your question. Thank you.
Good evening, Patricia. Hi, Patricia.
Hi.
Hi.
How are you?
Good. How are you doing? You hanging in?
Good. Pretty good.
Wow.
All right.
Well,
We'll go right ahead. Do you have a question?
Yeah, I want to know, I have a question. Will eventually they'll come up with medication? No, it will slow this whole virus. It will slow it down a bit.
Yeah, I mean, that's what we're hoping for, obviously, but I think we're hearing, I think the last report was 12 to 18 months for a vaccine?
yeah, a vaccine is something that, it's in the future. They're looking at medicine that might be helpful to treat it. Again, this is something that the whole world is confronting, so if there's any good in that, it is some of the best minds in the world are working at this together right now to try to come up with a variety of responses, and science is working diligently at this.
So, Patricia, in the meantime, as Karen and the chief have said, please take care of yourself, okay?
Yes.
Patricia hung up. So next question is from Facebook, and Mark asks whether or not the panel, whether the city feels as though that there are enough ICU beds available to adequately handle the response. If you could comment on that.
Well, our public health director, Chris Webb, has said no. But I think that's something that the state has been actively working on, to try to come up with facilities to be able to add beds as this crisis continues to unfold. So I think Governor Baker just this week announced, I think in conjunction with Mayor Walsh out of Boston, that they are coming up with some areas where they're going to be able to add more beds.
We do want to remind everyone that we've got this running in various places. There are a few folks on YouTube Live who are trying to ask their questions. We just want to encourage you to go ahead and head over to Facebook to ask those questions. That's where we're monitoring, or they can call in. The dial-in number should be put up relatively soon here. Yep, so it's 781-388-9394. So we'll take those calls in studio, or you can message our Facebook page, and that's where we're taking the questions. And we do have Marie now. Marie is the next caller. Marie, go ahead and ask your question.
Hi, Marie.
Hello.
Hi, I was just wondering, in the near future, are you going to have another update, like this, like you're having tonight?
Oh, I see. Another forum. Yeah, we've been trying to do those pretty regularly. So we did one last week. We're doing one tonight. And we're going to continue to try to do those. In the meantime, we are going to issue cases as we hear about them from the state. So we will do that as soon as we get the information from them to you.
Oh, okay. Thank you.
All
Bye-bye.
right. Bye-bye.
Okay, so actually, I think we're covering a lot of topics here. We're now, we're approaching 2 hours, which is great. We've covered a lot here, so I think we're going to potentially be winding down here, because I think the questions are starting to wind down as well. Okay. But as mentioned, we'll probably do this again down the road. Any questions that were not answered, we're going to go ahead and comb through Facebook tomorrow and reply to as many of those as possible. But please do keep your questions coming. They're helpful. They're thought-provoking. They help us to be better able to respond to this. So thank you. We have another call coming in now. We're going to hold off on that. We're just waiting for that to queue up right now. Okay, so we're able to get that caller right online. The name again? Davia. So Davia, go ahead. You are on the air with the panel.
All right, good evening.
Hi.
Hello.
Hi.
Hello, go ahead.
Hello, I had a question regarding the K through 8 schools. As we know that the school...
Yep.
Yeah, Davia, we would ask you that if you just could turn down the background noise.
So is there a way for them, for the K through 8 schools also to start online schooling?
That's being looked at by our superintendent in conjunction with the Department of Elementary and Secondary Education. Nothing's been decided yet, but they are looking at alternatives as we undergo this crisis. In the meantime, I know they have been putting up resources. I know Ms. Brennan today posted something up that would help our students while they're out. So if you're not following Malden Public, I think it's www.maldenps.org, and on Twitter it's @MaldenPublic, where they've been, making a series of posts to try to help families during this time. But we'll let you know if we hear anything regarding online learning.
Okay. Can I ask a follow-up question on this?
Yep.
So the follow-up question that I have is, so basically, the 8th graders who will be moving to the high school, I think they will be losing a lot because they are missing on these weeks. So if something can be done, especially for the 8th graders, that would be really helpful.
Nope, we agree, and that's something we're actively working on. I just spoke with the superintendent before we came up here, so hang tight. I know it's difficult, but we will be in touch as soon as we have more information.
Okay, so as we wrap up, we did get a follow-up here from Deanna, who says, please make sure to tell Chief Molis, thank you for keeping me 6 feet back.
Okay, yeah. I didn't have to pepper spray her or anything. It was just a verbal command, and she complied, and she was very nice about it. So thank you for that.
So I think we do have one call queuing up, and I think that's going to be our last call of the evening. Okay. And I'm going to go ahead and see if I can round out on the Facebook side of things. So while we're waiting for that, we do want to, again, thank everyone who's participated. We will respond back to as many of these questions that were unanswered as possible. And then just to confirm with the MATV folks, this will be on rebroadcast probably several times on loop. So if you want to tune back in if you missed it, YouTube Live will turn into a YouTube hosted program as well. So you can watch it online. We will link up to that on our website, on the city's website as well, which is cityofmalden.org. And again, to reminder to all folks that that is where we are storing all of our COVID-19 information and all of our updates. So, all right, so our last caller of the night is Kevin. So, Kevin, go ahead. You are on the air for your question.
Kevin?
Hello.
First off, I'd like to thank, like it was said in the program, all the, first responders, all the doctors and nurses that show up to work every day, our police department, fire, our, city leaders who put themselves at risk from having meetings and so forth to keep us safe. I thought I had a handle on this, and I think like most people, my fear is that COVID-19, it doesn't discriminate. It targets any and everyone.
Right.
With that being said, I'm a little confused after hearing that we might be 18 months away from, any kind of, serum or vaccine. What is the process we're going through right now doing for us then? And we're just sheltering in place for a few weeks, but this thing may be going on for like a year and a half. What do we gain from this? What's the purpose?
To, I think, lessen the number of individuals that develop COVID-19. It's to get a handle before something draconian happens. That's why I think that's what the effort is right now, is to understand, learn, and be able to move forward. Right. I don't know if you want to add
again, not speaking from any medical or scientific background, we are drawing from examples where some places in the world have suffered less of a devastation. This has been addressed in some parts of the world in very effective ways. There are some villages in Italy that were less affected than others. There are other countries that had a less of a spike, less of a burden on the emergency health care potential that those countries had. So what we're doing is we're drawing from examples around the world where things have been tried, things that have happened, but the ultimate goal is for us to minimize and reduce the number of cases, reduce the burden on the healthcare system, reduce the vulnerability to those who are from a certain age group or a certain compromised immune system. So the ultimate goal here is to keep the numbers as low as possible through time, and then hope that this can, run its course. And then at the same time, areas of science are looking at better ways to address it in the long term with regard to, some type of, medical response or the creation of some drugs. But that's why, as you said, we're all in this together. You said it doesn't discriminate, rightly so. But that means that we all have a purpose, we all have a role, that no one should really just sit back and depend on everyone. At the end of the day, your safety is up to you. Your safety is how you live your life. Your safety is how you take the information that's given, the real information, the information you're hearing tonight. That's why the mayor has done such a good thing to have something like this, so people can get information, timely, accurate information, and draw conclusions from that, not based upon speculative postings on social media that oftentimes lead you in the wrong direction. So again, I want to thank you for starting out by commending those that are in this, and there's no better example than this here, that the cops, the firemen, the doctors, the nurses, the home health care workers, the people that are going out and visiting the most vulnerable. I know someone today that was going out to visit people that have no means on their own. So we're all in this together.
Do you want to add, Karen?
Yeah,
I wholeheartedly agree. And like you said, information is power.
And we got to
Yeah.
look at this. Go ahead, Karen.
I actually was going to say, you know,
Thank you.
similar things have crossed my mind too, especially when you hear that a cure or something, a vaccine is so far off. But what they're really trying to do, if you think about, people are still.
Go ahead.
Bye. But anyway, but I'll say the people are still getting sick. They're falling. They're hurting themselves. People are having babies. So what you're trying to do is lessen the surge. So, you know, by lowering it out and staying home now, hopefully instead of like peaking like this when there's other people in there that, you know, in the hospitals already and be overloaded. So what we're trying to do is make it more of a, you know, a slow, gradual uptick and then back down.
Right. And every day counts. This is
Yeah.
this is a marathon, not a sprint. So, you know, by you calling in tonight shows us that you're willing to, you know, be a part of the solution, and we want to say thank you for that.
I'm very impressed with the callers, the questions, and the interest. It's reassuring.
Okay, so we're wrapping up, and we want to say thank you once again for, you know, the support that we've received from all of you on trying to keep our community healthy. I know this is a really difficult time. I know right now I'd be getting ready to watch our athletes participate in spring sports. I'd be calling bingo at 630 Salem Street. I would have been at the mall last weekend with my mom, and this has just turned everything upside down. But the one thing I know, based on working with our police chief and our Human Services and Community Outreach Director and MATV and Maria Louise and Ron Cochran and everybody else, you know, we're going to get through this. Just continue to do your part, and I am certain that our best days lie ahead. So once again, thank you.
We're done.